How does alpha-1 antitrypsin deficiency affect COPD? Have you ever wondered how a genetic condition can impact your lungs? Today, we will discuss how alpha-1 antitrypsin deficiency affects chronic obstructive pulmonary disease. Alpha-1 antitrypsin deficiency is a genetic condition that can significantly increase the risk of developing chronic obstructive pulmonary disease. This deficiency occurs when the body does not produce enough of a protein called alpha-1 antitrypsin. This protein is made in the liver and plays a vital role in protecting the lungs from damage. When inflammation occurs in the lungs, white blood cells, particularly neutrophils, releases an enzyme called neutrophil elastase. This enzyme helps fight infections but can also harm lung tissue if not properly controlled. In individuals with alpha-1 antitrypsin deficiency, the lack of sufficient alpha-1 antitrypsin means there is not enough protection against this enzyme. As a result, neutrophil elastase can cause unchecked damage to lung tissue, leading to inflammation and destruction of the air sacs, known as alveoli. This damage is a key factor in the development and progression of chronic obstructive pulmonary disease, especially emphysema. Emphysema is a form of chronic obstructive pulmonary disease characterized by the breakdown of alveolar walls and reduced lung elasticity. People with alpha-1 antitrypsin deficiency often experience symptoms of chronic obstructive pulmonary disease earlier in life, typically between the ages of 40 and 50. This is particularly true for smokers, who are at an even higher risk. The symptoms of chronic obstructive pulmonary disease due to alpha-1 antitrypsin deficiency are similar to those of typical chronic obstructive pulmonary disease. They include shortness of breath, wheezing, chronic cough, excess mucus production, fatigue, and chest discomfort during inhalation. Since alpha-1 antitrypsin deficiency is a genetic factor, it is the only known inherited cause of chronic obstructive pulmonary disease. Identifying this deficiency in patients with chronic obstructive pulmonary disease is essential. It can influence treatment decisions, including the potential use of alpha-1 antitrypsin replacement therapy. This therapy aims to restore protective levels of alpha-1 antitrypsin and slow down lung damage. In summary, alpha-1 antitrypsin deficiency affects chronic obstructive pulmonary disease by removing a critical protective mechanism in the lungs. This allows enzymes from immune cells to damage lung tissue and accelerate the onset and progression of chronic obstructive pulmonary disease symptoms. Early diagnosis and targeted treatment can help manage the disease more effectively.